Dr. Timothy Jorgensen, chair of the Radiation Safety Committee at Georgetown University Medical Center, joins us tonight. Dr. Jorgensen, thanks for being here.
Thank you.
Let's begin with the human impact. The Japanese government, as we heard Laura say, is ordering people not to come within a 12-mile radius of that plant. The U.S. is urging Americans to stay at least 50 miles from that damaged reactor. What is the risk to those people in Japan who are in that 50-mile radius, and even those, say, further away in, like, Tokyo?
Well, I think the immediate risk to the people is that one of these nuclear power plants will have a meltdown and there'll be a large emission of radioactivity. And I think the risk depends exactly on what the weather conditions are at the time. So if the weather conditions blow this radioactivity over these people, they have some risk. And so the further away from it you are, the better off you are, the less likely that this is going to happen to you. So in general, the further the better. That's the situation.
Let's talk about the folks who are right there. There's 50 brave workers who have vowed to stay at that plant to try and avert a meltdown. What is the risk to them?
Very high. I think that they risk acute radiation sickness. In fact, I heard in the media that the Japanese government is considering asking some of these people to do tasks that would involve lethal doses of radiation. So, the consequences of these lethal doses won't be seen for days or weeks, and so it is possible for a person to sustain a lethal dose and still keep working for days or weeks. And so basically, if that's what they're being asked to do, they are true heroes of the situation.
Indeed they are. As we look back over history of other nuclear disasters, how does this compare to, say, 3 Mile Island and also Chernobyl?
Well, the International Atomic Energy Agency ranks these things on a scale of 1 to 7, 7 being the highest, and Chernobyl was a 7. 3 Mile Island was a 5, I believe, and this is now a 6, so somewhere in between 3 Mile Island and Chernobyl.
Now, the situation in Japan is still unfolding right now. We don't know what the final outcome would be, but based on history and what we've seen with the other 2 incidents we just spoke of, what do you think we are looking at into the future if you could look into your crystal ball?
Well, the reality is that the risk to these people is a risk that most likely they will incur, if anything, an elevated radiation dose, which puts them at risk for cancer down the line, 10 years, 20 years, 30 years. But the real thing is that these people have immediate problems of dealing with the catastrophe of the tsunami and the earthquake. And they have exposure issues and all of the medical issues and all those things. And I think this is the real priority now. Yes, they have a risk of getting cancer in 10 or 20 years, but what needs to be remembered is that we need workers in there to work and save these people and disregard a potential risk because the need is so great.
Indeed it is. All right. Dr. Timothy Jorgensen, chair of the Radiation Safety Committee at Georgetown University Medical Center. Thanks for coming in tonight. We appreciate it.
Thank you very much.